Well, positive tests and outbreaks linked to COVID-19 are increasing in Canada. That's according to the federal government's latest data. It comes as COVID-19 vaccination campaigns start to roll out. But for the first time, will come at a cost for a number of people this year. Joining me now is Dr. Bogoch, infectious disease specialist. Good morning, Dr. Bogoch.
Hey, good morning.
Let's talk about and get into these positive tests and outbreaks. These are coming out of hospital settings, coming out of long-term care, in particular areas that we know that are still testing, right? So kind of put those increases and those numbers into perspective for us.
Yeah, I mean, we started to see a rise in community transmission of COVID in the late part of the summer. We know it's going to escalate and continue to rise throughout the fall and into the early winter time. We're also going to start to see, unfortunately, a very predictable rise in influenza and respiratory syncytial virus, also known as RSV. We'll start to see those start increase in community settings, as we move through the fall, and then they'll start to decline in the later part of the winter season as we enter spring. Before 2020, it was just flu and RSV. Sadly, now we have COVID to the mix. But hey, we've got impressive steps to ameliorate the burden of infection and prevent infection. And of course, we should be taking those steps as we enter the fall and winter season.
I know we always look to Australia, right, to kind of get a sense of what this respiratory viruses season is going to look like. Do we have any indications right now of what Canadians should expect and how bad it's going to be this fall?
Yeah, I mean, it's a great point. And that's a imperfect, but still the best we have predictor. Australia had a rough influenza season this past season, not as bad as 2 seasons ago, but it sounded like it was particularly impactful. Yet another reason for us to double down on our efforts to really ensure that when we roll out our COVID and influenza and RSV vaccines, that people who are eligible come out and get it. I think we should be ensuring people are aware that, 'tis the season, unfortunately, and there are steps that they can take to protect themselves. Last year's influenza season in Canada was also very rough. And when we look at hospitalizations, for example. But I think this season, it's hard to predict. We say it's predictably unpredictable, but it's likely that it'll resemble our season last year.
I want to touch on COVID vaccines if we can, too. They are going to be free for anyone in a high-risk category this year still, but there are a couple of provinces where the shot is not going to be free. Some people will have to pay for it, and depending on what areas of the country they're in. Are there concerns that this is going to cause people to back off, that those vaccination rates might go down a little bit, too, as a result of people having to pay for a vaccine?
Yeah, I think there certainly is. The key here is there's 2 real categories. There's people who should be getting the vaccine, and then people who may get the vaccine. The vaccine is free of charge for everyone in the should get vaccinated category across the country. But yes, as you point out, there's a couple of provinces who will be charging for this for those who are in the may get vaccinated category. I think if you ask 100 people, you're going to get 100 different responses here. My take is that we should not be building barriers to vaccination. We should be lowering barriers to vaccination. Whether or not you're in the may get vaccinated category, it should still be available to you. And for people who choose to get it, they should be able to get it free of charge. That's my take.
Dr. Bogoch, infectious disease specialist, appreciate your time today. Thank you, sir.
Thank you so much.